Last month, we told you about a brand new procedure just approved by the FDA, pioneered at university hospitals. LimFlow gives people hope for an alternative to leg amputation. After our story, News 5 viewers reached out asking how all of this works. Tessa DeTiro is following through tonight with an explanation and shares the story of a woman who says she got her life back because of it.
Inside the operating room at the University Hospital's Harrington Heart and Vascular Institute, Dr. Shishehbor is working inside the cath lab. Dr. Shishehbor served as the lead author and co-principal investigator of a study of a brand new procedure called LimFlow, just approved by the FDA in September.
The way LimFlow works is by diverting blood from blocked arteries into the veins and making the blood flow reverse inside the veins and getting oxygenated blood to the foot.
Entering through the patient's foot or abdomen, it's a minimally invasive procedure. University Hospitals is one of only a few centers in the country performing LimFlow, and Dr. Shishehbor is the only doctor at UH providing the treatment. The procedure could be life-changing for thousands of people who suffer from chronic limb-threatening ischemia, a severe vascular disease.
Patients that lose their limb are at the risk of death. 50% of them are dying within 2 years because of the quality of life, inability to be functional.
After already having one leg amputated, Cindy Elford, a type 1 diabetic, came from Pennsylvania to University Hospitals.
In her case, she had gone to multiple institutions to try to get help and to try to get some blood flow. On top of that, she was in a lot of pain.
And he came back and he was yelling and screaming, "I think I know what I can do for you."
Cindy, the first patient in Ohio to undergo the procedure, was able to keep her right leg.
I have my daughter here. We're making cookies. And I have 3 grandchildren that mean the world to me.
What does Cindy mean to you?
A lot. A lot. Seeing her be able to walk, enjoy, make cookies, run with her family is a reflection of a career. It's like the fruit of your labor and the work that you have done. And the honor of being able to impact someone like that is huge.
Cindy says she's more active than ever, traveling, hiking, and soaking up lots of quality time with friends and family.
I think if I wouldn't have met him, I would have died. I would have given up. He basically saved my life.
Tessa DeTiro, News 5.